Good afternoon, good afternoon, good afternoon. We will start in a couple of seconds, if that's okay. I'll just let the lobby quieten down a little bit as people come in. Lovely to see you. Those of you who want to put your cameras on, we really love to see faces. It does make for a more engaging webinar. I understand not everyone is able to pop their camera on. I'm going to start if that's okay. We're just waiting a few more that are joining, but I'll get started. So good afternoon. My name is Richard Ayres and I'm a social care advisor at Care England. And I want to welcome you to our another joint Hempsons and Care England webinar, which is designed to help care providers really understand what good looks like and how to get to outstanding. Now, today is another webinar in our series with Hempsons. I think it's our 7th, with Philippa Doyle, the head of social care at Hempsons. It's going to review with you compliance with the regulations, the CQC regulations, and spell out how you can demonstrate evidencing that your services are worthy of a good rating. And then Jolena who's a solicitor at Hempsons, will also look at it from her side, and so who works side by side with Philippa, and she will talk about how you can take those ratings from good to outstanding and give you an analysis of some of the recent ratings and what those services did to secure that sort of outstanding gold star rating. And I know Jolena has spent the 3 days immersed in outstanding CQC reports to really pull that evidence through for you today. So I think you're going to find that really helpful. When Philippa and Jolena have finished talking, you are free to use the chat facility to raise your hands directly or ask any questions in the chat facility. Or you can email me and I will drop my email address in the chat if you prefer that I ask an email on your behalf anonymously. I will ask you keep yourselves muted while they are presenting. They will take us through a few slides, which are going to go through about 45 minutes of slides and talking, but they're very informed slides and you'll get a copy of those slides afterwards, after which time I'll facilitate that question and answer. And any questions that have come up in the chat or have been emailed to me, I will raise at that point. Again, at that point, you're also able to pop your hand up and ask questions directly. So we will record the session and our intention is, as always, to note down any questions we haven't been able to answer, and we will try and get an answer to you as early as possible. Philippa and Jolena are incredibly busy. We were just talking about how crazy their weeks have started looking, and Philippa had a free day yesterday. She doesn't anymore. But if you would like to ask any questions anonymously, yeah, I'll drop my information in the chat as well, and we will get back to you with answers to all of those questions. So without further ado, please let me hand over to Philippa, who will start us off today, and then I'll hand over to Jolena afterwards. So Philippa, over to you.
Thanks, Richard. Good afternoon, everybody. Jelena's going to share her screen and share the slides, which I can see. So if I can have a thumbs up from somebody to say that you can see them as well, that would be great. Brilliant. Thank you, Richard. So this afternoon's session, you've got me. I'm not sure that I need that much of an introduction to you all anymore because we've done lots of events together now. But just for a tiny bit of background, for those of you who've not met me before, my name's Philippa Doyle, as Richard said. I head up our health and social care advisory team at Hempsons, and I've been doing this for over 25 years now. I've just gone past my 25-year anniversary, so I've got an awful lot of experience in working with providers of all sorts of shapes and sizes, and in the certainly in the last sort of 10 years or more have really become a little bit of an expert in all things CQC. So I'll let Jolena introduce herself as well, and then we'll get cracking with the rest of the session.
Hi everybody, I'm Jolena Bullivant-Clark. I'm a solicitor in Philippa's team at Hempsons. I've got 3.5 years of experience from working in her team, and I've been doing quite a lot of factual accuracy challenges under the new single assessment framework, so I'm quite familiar with all the quality statements now.
Brilliant. So the session this afternoon, as Richard said, is we're going to focus on what good looks like, what does it look and feel like, and then towards the end of the session we'll look at how we get to outstanding. So if we can go on to the next slide, please. What good looks like is effectively scoring 3s across the board in your new CQC assessment process. So that equates to getting a percentage score of 63% or higher. So basically you need to ensure that your service is about 2/3 as good as it possibly could be. You do also need to be aware that there is a rating limiter around getting that good scoring. So you could be getting, loads and loads of 3s. but actually get a stray 1, so an inadequate score on something. If you do, and I had a conversation with a provider just this morning around that they've got a stray 1, that's going to limit your rating. So it's going to pull it down to a requires improvement. So CQC, to give you a good rating, are really looking for that across the board assessment to show that you're really solid and you're really sound. But what does it actually look and feel like, though? My starting position to everybody is that it's compliance with the regulations. If you get those back to basics right, if you can demonstrate within your service that you are meeting the requirements of the regulations, if you've got policies and procedures in place, if your systems and processes are embedded and they're sustained within the service, and you're a service that can demonstrate that it's a really solid, safe pair of hands, and that people are safe in your service and it's a well-led service, then that's going to give you a good rating. Doesn't need to be fancy, it doesn't need to be doing anything special, but it does need to be getting the basics right. And so if we're looking then at that compliance with the regulations, and compliance with the regulations being that kind of real fundamental, over onto the next slide, the most important thing you can do is get hold of a copy of the regulations and read them. They're actually a really easy read. When I do my fundamental standards training, that I know lots of people on the webinar will have been through that training. We've got a copy of the regulations. I've got my very battered, tea-stained copy here, if you can see that. And we do a page turn. We go through the regulations. They're really, really readable. They're really easy to follow through. And they really make you think about what you're doing and why you're doing it. Can I make sure that people are muted, please? Thank you. So do get a copy of the regulations. Do make sure you have a read of them. When you go through them and you're looking at Regulation 9, person-centred care, or Regulation 12, safe care and treatment, there's lists of 9 different things that CQC are looking for. And when you sit there and you think about those lists of things and you think about your services, you'll probably find that there are some small areas of weakness, of things that you might struggle to demonstrate to that higher level to CQC that you're actually compliant with. Most services are delivering really great care, and they're delivering a really good service to the people that you support in what I know is really, really hard times. But what CQC are assessing you against isn't just the feel of the service. It isn't those Andrea Sutcliffe days of, the mum's test and would I be happy with my mum living here? It's very much around the documentation. Can we evidence? Can we document to CQC? Can we show that we've got all the right policies and procedures in place, that we've got the right care plans in place, that we're reviewing everything when we say we're going to review it, that we're responding to risk assessments, we're responding when somebody has a fall, and we're changing how their care plan's being delivered. It's all of those elements which CQC are looking for, and they're looking to make sure that there are no inconsistencies and that you're actually delivering against those requirements in the regulations. So if we go on to the next slide, I've highlighted the 2 key areas that providers really need to focus on if they're going to spend any money, if they're going to spend any time on getting things really, really right. It always needs to be Regulation 12, safe care and treatment, or Regulation 17, good governance. So those are the safe and the well-led aspects of your CQC assessment and the report that is going to come through. Risk assessments are a really common theme across both of those regulations. Where services get them right, it's absolutely brilliant. You can see the risk assessment being carried out. You can see that tracking through into the care plan. You can see that tracking through into the information that the staff teams have got and the way the person's supported. Get those risk assessments wrong, or do a risk assessment and it doesn't track through into your care plan, it doesn't track through into communication information to the staff, that's where you can see yourself heading towards a requires improvement, or sometimes even an inadequate. And it doesn't matter how many times the staff teams say, oh, but we know everybody really well, and we don't let agency workers in our service. We don't let agency workers work on their own. We don't let them work without a thorough assessment. That may well all be the case, and you may be delivering great care to the people that you support. But if there's that inconsistency in the records, CQC will absolutely mark you down on it. And that's where kind of areas of concern around the really good work that staff teams are doing isn't always translated through into the documentation. And that's where, unfortunately, it can let you down. So if we move on to the next slide, I've talked about risk assessments. This is very much now about care plans. So to start with, review them, absolutely. Do that at least annually as an absolute minimum, but I would recommend that you do that more often if you can do it 6 monthly, but absolutely you need to do that if somebody's needs or presentation changes. And it does need to link through with those risk assessments as well. So if you're doing a risk assessment or you're amending something because somebody's presentation has changed, make sure that tracks through into those care plans. Don't rely on communication books within the service of, this has changed and that's changed and this is what you need to know about Mary and that's what you need to know about Brian. Don't rely on one-page cheat sheets or summaries on the people that you support, because they will rarely have all of the information that's needed about an individual. And frankly, CQC don't like them. They want to know that there's no inconsistencies in the information that's being shared within the service. So whilst you're providing this information to your staff teams to make life easier for them, it can also end up kind of coming back to bite you a little bit if there isn't the consistency in those comms books or the summary sheets, as well as set out in the risk assessment and in the care plans. Whether or not you're paper or digital, or probably a little bit of both in most services, that can also create problems, but it can also work in your favour as well. It doesn't need to be a problem. It only becomes a problem if you've got a situation where information is being updated on an electronic system, so being updated in the manager's office, but then the paper information that's available in the service is out of date. So CQC will come in and they'll pick up pieces of paper, they'll pick up care plans, they'll look at what's there. And if what they're reading looks like it hasn't been reviewed for a year, looks like it hasn't been updated, they're going to pick up on that and they're going to be concerned. So even if your systems are up to date in terms of everything electronically, do make sure that that's translated through to the information that's available within the service as well. If we go on to the next slide as to what else we should focus on. Risk assessments I've already mentioned. I'm not sure I can mention enough how important it is for risk assessments to marry up with care plans. But the other area that we see concerns creeping in, again, feeding on from those care plans and risk assessments, is PRN protocols. Are they up to date? Are they descriptive enough? Have they been reviewed in the last 6 months, in the last year? Do they properly describe what a person's behaviours might look like and how to support with those behaviours before you get to the point of administering medication? Or actually, are we talking about where somebody perhaps has loose bowels or is going in the other direction, when you might need different medication, and are those PRN protocols really clear on when the different medication might kick in, or whether there are alternative measures that could be taken that's a last resort. Audits is another really important area as well. CQC love an audit. They love an audit that identifies deficiencies, and they love an action plan. And again, that's where some services can fall down. They'll do all the auditing, but then they just do the audit and they file it. You've got to create an action plan that comes out of the audit. You've got to give yourself some specific tasks of things that need doing. Try and make them really short and sweet. Try and make them, only, 5 or 6 things on an audit that you're going to do within 1 or 2 weeks. and then tick off that you've actually done them and put some dates in to show that you've addressed those particular issues and what changes that you've made. Those are kind of really important areas and really important things that CQC look out for. Feedback's another priority area for CQC at the moment, and not just for CQC. It's my son's birthday today, so I've been ordering all sorts of things off the internet, and it doesn't matter what I order, I then automatically get an email from somebody about, rate the product and rate the service and do this and do that. Everybody is asking for feedback all the time. We ask for feedback at the end of the webinar around, how did we do and what else do you want us to talk about? But it's really, really important that you gather that information, both from the people that you support and from their families, but also from your staff teams, because your staff are your biggest asset. You really need to involve them in the running of your service. They'll feel much more valued. They will contribute much more. They will have all sorts of ideas on improvements or areas of concern because they see things from a very different angle and they see them from a very different side to maybe you as managers or owners of services. So do get staff involved as much as you possibly can, because they've got an awful lot to give and an awful lot that they can do to support the good running of your service. So it's all very well me telling you what I think good looks like. What does CQC say that good looks like? Well, if we go on to the next slide, when we used to have the old Key Lines of Inquiry, there was a publication kicking around called Key Lines of Inquiry and Ratings Characteristics. That document is still available on the internet. I've put a link there on the slide. So when the slides come out to you, you'll be able to click on it and have a look. And that used to be really good because it used to have loads of columns and loads of tables. It used to tell you what an inadequate service looked like, a requires improvement, a good one, and an outstanding one in all of the different areas. We're really pushing CQC for a similar publication. I know Richard and Care England have been in discussion with CQC about whether there's a scope to get that kind of handbook. There was a document kicking around last year that I saw. Really don't know whether that's coming or not. But actually, if you go back and look at the old guide, it's still really, really useful because the principles behind what a good, safe service looks like haven't changed. And as I always say on all of these webinars, the regulations haven't changed. So what I thought it would be useful to do was just to illustrate this by, on the next slide, looking at an example in relation to safeguarding, because obviously safeguarding is a priority area for everybody. And I picked out an extract from the old document, and it related specifically to safeguarding, and it said that people are consistently safe and protected from bullying, harassment, avoidable harm, neglect, abuse and discrimination. And CQC were looking to see that the service had got effective safeguarding systems, policies and procedures, that they managed safeguarding concerns promptly, they used local safeguarding procedures where necessary, where required, investigations were thorough, and there was a consistent approach to safeguarding and matters were always dealt with in an open, transparent and objective way. So if you feel like that's a fair reflection of your service, that's what you're doing all the time, then you're meeting the standards, you're meeting the requirements of what CQC are looking for to ensure that you're delivering safe care and you're meeting those safeguarding requirements. Under the new single assessment framework, there is a quality statement for safeguarding. And that says we work with people to understand what being safe means to them, as well as with our partners on the best way to achieve it. We concentrate on improving people's lives while protecting their right to live in safety, free from bullying, harassment, abuse, discrimination, avoidable harm and neglect. So if you look at that old definition of what being safe meant, if you're doing all of those things, then you're meeting that requirement under the new CQC quality statement in relation to safeguarding. So that's going to get you a 3 straight away. If you're going above and beyond that, because if you're doing a lot of extra work around how people feel supported and how they feel safe, then you may well have some evidence that you can put forward to CQC that's going to show you that actually you're outstanding in this area. So I don't think that the old publication is ready for the shredder yet. I think it's still a really useful guide that organisations can use to get guidance from around what CQC are looking for. So just to sort of bring my session to an end with my final slide before I hand over to Jolena, all I will say is that it is not magic. Oh, the screen's gone black. Do we know why the screen's gone black? Has everybody else's screen gone black?
Yes, Jolena, maybe just
Mine's
put it
not
onto
black. Mine says I'm sharing my screen.
No, it's black.
Right,
Yeah.
bear with me. I'll take
Just
it off
pop.
and put it back on again.
That's it.
You'll see it on the slide when it comes up anyway, that all I was going to say is there really is nothing that you need to do, there we go, demonstrably different than you were doing before. If you were meeting the regulatory standards before and you're meeting the regulatory standards now, then you're going to be good. But the thing that I would say is that if you were last assessed 5, 6, 7, 8 years ago, things have moved on quite significantly. New assessments and the new approach by CQC is all about evidence. It's all about your documentation and getting your documentation right all the time. Kind of the old lawyer's phrase of if it's not written down, then it didn't happen, has never ever been a truer statement than with CQC at the moment. Go through your policies and procedures, review them all, make sure that they're all up to date. Go through your care plans and risk assessments, review them all, make sure they marry up together, make sure they're up to date. Get that feedback, use it, analyse it, make changes, feedback on the feedback about what changes you've made within your service. Those are the things that CQC are looking for. Nothing magic, nothing special, just what you're doing on a day-to-day basis, but doing it well and making sure the documentation reflects the really good work that's going on in the service. Now, the magic bit is what Jolena's going to talk about now. So I'm going to hand over to her and she's going to take you through how, if you're doing it right all the time, how you can then get to those mythical 4-point scores and hopefully get those green stars.
Thanks, Philippa. Hopefully the PowerPoint will hold up. So I've had a great time over the last few days reading about services who've achieved outstanding. So I've read lots of lovely CQC reports, which has been a really positive time for me. And I've actually managed to find examples of outstanding in each of the 5 domains. So I'm going to take you through those. So the first one, obviously, if we start with SAFE. So this is a residential care home in Lincolnshire that was inspected in March 2025. CQC looked at 8 quality statements in the SAFE domain, and I've made a list of them there. So they looked at learning culture, safe systems, pathways and transitions, safeguarding, involving people to manage risks, safe environments, safe and effective staffing, infection prevention and control, and medicines optimization. They actually achieved 4 4s and 4 3s. So that's an overall score of 88% out of 100. So what I have done on each domain is I've then picked out where they've got 4s, some examples of things that I thought were really, really cool, a little bit different, and just a bit innovative and exceptional. So I've popped them on the slide. So one example, so they've maintained good working relationships with external professionals and worked proactively to agree a hospital discharge plan in relation to a complex individual who needed kind of really clear transition plannings with a lot of people that were involved in a professional MDT. So that comes under the safe systems and pathways quality statement, and the service was praised for being really proactive there. The second one, so they've followed up on DOLS restrictions. So what we do often see is people who are in residential services who need deprivation of liberty safeguard authorisations. That's the responsibility of the local authority to assess and grant, and sometimes they can take longer than the statutory time period to do so because they've got so many to do. So what this service did was actually looked at those who were under DOLS restrictions or had DOLS restrictions that were expiring or expired, and they made active plans with them to improve their skill sets and make sure that, you know, any restrictions that were unauthorised were being really carefully monitored and reduced wherever possible. So they were taking a really proactive approach to their DOLS authorisations there, alongside chasing the local authority to come in and do that proper assessment. So that comes under the safeguarding quality statement, and DOLS is something that CQC do tend to focus on. They also supported people to learn new skills. So they had workshops around working safely in the kitchen, looking at cooking, looking at food hygiene, looking at food safety, and they turned that into a whole learning module for a number of their individuals. And so that comes under the involving people to manage risks quality statement. And then I really liked this one, actually. So the last one, they created easy read job descriptions, and they actually trained some of their residents to be able to participate as members of the interview panel when they were looking at hiring new staff. So that was a really cool way of helping the people that they supported to feel, you know, really involved in their staffing choices, and meaning that some personalities could be matched up, and we all know how important, you know, personality matching can sometimes be in some of these services. And also, the same service was asking people to choose their own key workers to make sure that you know, their needs and their personalities all matched those of the people who are working most closely with them. So that comes under the safe and effective staffing quality statement. So there's a couple of examples there in relation to safe. And then I looked at effective. So this is a different home. They're based in Humberside, and they were inspected in June 2025. CQC looked at 6 quality statements, and they looked at assessing needs, delivering evidence-based care and treatment, how staff, teams and services work together, supporting people to live healthier lives, monitoring and improving outcomes, and consent to care and treatment. And so this service got 3 4s and 3 3s, so about half and half, but they ended up with an overall score of 88 out of 100. So a couple of examples here of things that I thought were really cool. So they were creating person-centered PBS plans, and those included detail on how to respond in times of crisis. So they were looking at signs to look for, and actually they had a little paragraph in that PBS plan around, you know, this is how I expect you to react when I'm in crisis. This is how I expect you to interact with me. And this is how I expect you to calm me down. So that was really helpful. And they also encouraged people to support the in-house chef with meal preparation and choosing their own menu. So both of those come under the assessing needs quality statement here. They also had an external clinical psychologist looking at monthly behavioural assessment meetings, and that was helping to inform support for a particular individual. So that would come under the how staff, teams and services work together quality statement. And then the next 2 were some nice ones that I found within supporting people to live healthier lives. So they ran a 5-a-side tournament across multiple sites that were within their care home group, and that was a way for people to keep fit and broaden their social network. And actually those people who weren't able to participate were placing bets on which team would win. So it was a really good way of bringing everybody together and helping them socialise. And they were also looking at social prescribing for one person to help them live more independently and be able to take more of an active role in their healthcare choices. So I liked all of those. That was under effective. Then I moved on to caring. So I looked at a central care home that's based in Barnsley that was inspected in January 2025. They were assessed across 5 quality statements. So CQC looked at kindness, compassion and dignity, treating people as individuals, independence, choice and control, responding to immediate needs, and workforce wellbeing and enablement. And they achieved here 3 4s and 2 3s, so they got an overall score of 90 out of 100. So I had a couple of examples here in relation to fun things within caring. So they had appointed dignity champions, and they were exploring respect and dignity during team meetings to make sure that, you know, staff could give any feedback about how they could champion that even further within the service in relation to supporting specific individuals. And that was actually a tick box on their management quality audit as well, which I thought was quite different and quite nice. They were involving people to cook their own meals and helping them to choose them, and staff are actually sitting and eating with people to provide quite a nice mealtime experience. So all of those come under the kindness, compassion and dignity quality statement. Then when we're looking at treating people as individuals, they provided quite a range of activities. So they had a sensory room, they had football tournaments for a particular individual who liked football. They were having regular garden parties. They had a barbecue and a pizza oven, very fancy. And they were also running gardening and planting groups. There was a lady there who was very, very close to her dolls. She was very into her dolls, and they ran a whole session for her around caring for the dolls in the swimming pool. I think that one needs a bit of context. I have to say, it wasn't very clear from the report. And they were also supporting people to register to vote. So that's quite a range, and that was all coming under the treating people as individuals. So this care home had really made an effort to get to know each and every one of those service users and planned around their needs and their likes and their dislikes. And then workforce wellbeing and engagement. So they looked at celebrating staff achievements. So they had a Hall of Fame board where they would put up staff who'd done really, really good work. They had regular team building outings, and they also had a 24-hour mental health assistance line. And actually, I looked at a lot of homes that had got outstanding in caring, and actually it was really impressive to see they all had 4s in workforce wellbeing, and that does seem to be something that CQC are looking at commonly. So it's not one to leave out or underestimate when you're doing your preparation for inspections. Then I looked at responsive. So this is the same residential care home in Barnsley. And I've mentioned this service twice because at their last inspection in 2021, they were found to be requires improvement overall. So over 4 years, they've improved to being outstanding in 4 out of 5 domains. So it really is an example of what can be achieved in a relatively short time frame. And also, you know, with a really clear focus on the single assessment framework and, you know, gathering all your evidence. So when they looked at responsive, CQC assessed person-centred care, care provision, integration and continuity, providing information, listening to and involving people, equity and access, equity and experience and outcomes, and planning for the future. So that's 7 quality statements. And within that, they got 4 4s and 4 3s. So they got 89 out of 100. In terms of a couple of examples, there's quite a few on the slide, and the first 3 relate to the person-centred care bit. So they were supporting people to buy the clothes that they wish to wear. They were making sure that they were using and checking preferred names and pronouns, and that was all written in their care plans. They were putting personal effects of people's living spaces, and they were actually helping them to be involved in decorating. So they were asking how those people would like their space. So the person that liked football that I mentioned earlier had lots of football memorabilia in his room, and the lady who loved her dolls actually had photographs of all of the activities she'd done with her dolls and the time that she'd spent with them, and they were displayed on the wall, which I thought was really nice. They were also looking at putting together an individual signing system for a particular service user who had more limited communication needs, and they'd delivered bespoke training to all of their members of staff, even ones who weren't part of their core team, to make sure that everyone could interact with that one particular person. So they all came under person-centred care. The next 2 came under care provision, integration and community. So they were making sure that people had dedicated, consistent core teams of staff who knew people really well. And they were also advertising all of their key events and their activities on a notice board. They were also putting up art and poems and things that the service users done and things that staff had done. So they were really communicative in relation to that. And that all got them extra points in relation to that care provision, integration and community quality statement. The next 2 are listening to and involving people. So they, alongside all of those activities and that pizza oven and that barbecue, they were also celebrating quite a range of key dates, and they planned their key dates around needs, personalities, and opportunities to identify learning. So not only did they have, you know, VE Day and Chinese New Year, but they were also focusing on, they had an Autism Week, which had a number of educational workshops around management of autism and understanding those with learning disabilities, and they also had a mental health day. So that was a really nice way of focusing on not only putting on activities, but making sure that those activities actually go towards a common purpose. And the final one that I noted here under planning for the future as a quality statement. So planning for the future does make a lot of reference to end of life care, and it can feel really difficult when you are supporting people of a younger age that are not at that stage of their journey. But actually, what got these people extra points was they also had a year plan for a particular individual. So they sat down with them and they said, what do you want to achieve this year? And the person said they were wanting to learn to drive and obtain a passport. So they had a clear goal mapping document in there, and that got them extra points in relation to the planning for the future quality statement. So I did like that one because I thought it was a really good example on quite a difficult quality statement. So then lastly, Well-Led. So this is a domiciliary care agency that's based in Shropshire, and they were inspected in July 2025. So they looked at 7 quality statements across Well-Led: shared direction and culture, capable, compassionate and inclusive leaders, freedom to speak up, workforce equality, diversity and inclusion, governance, management and sustainability, partnerships and communities, learning improvement and innovation. So quite a lot there, and they got 5 4s and 2 3s, so that's 93 out of 100. So my examples here, so the first 2 are around shared direction and culture. I really liked this one. So they included a questionnaire for prospective staff members to make sure that their beliefs and values aligned with kind of the service direction and culture. So I thought that was an interesting way of meeting that kind of shared direction quality statement. And they also had quite a lot of praise from staff members for the family-like atmosphere and the strong morale and the commitment to people and staff's well-being. So that kind of fits in with the culture of the service. And sometimes it can be quite hard to demonstrate, but they obviously had some really good feedback there, and that was consistent across multiple evidence categories. Then we had capable, compassionate and inclusive leaders. So the nominated individual, the registered manager and the other senior managers here were known to all members of staff and all service users, and that meant that they were really accessible and they had really open conversations with staff. Governance, management and sustainability is the next one. So they had individual goal planning in their staff supervision meeting. So instead of looking at, well, I think they were also looking at competencies and how the people were doing their jobs and how they were developing, but they were also looking at, you know, where that staff member wanted to be in the future and where they wanted to end up. So I thought that was really good evidence of that kind of compassionate and inclusive point. They also encouraged mental well-being through physical activities and social events. So there was one person who was struggling to get outside and struggling to socialise and kind of really maximise their healthy living goals. So they realised that was because of their call times and their care tasks, and they did a huge piece of work with them around rearranging those and making sure that they could fit kind of both things into their day, and that meant that person had made lots and lots of progress in relation to getting outside and being active. So that came under the partnerships and communities quality statement. And then the last one is around learning improvement and innovation. So they had reviewed someone's health presentation and their care records, and they've done a really in-depth analysis looking for solutions to help them feel less restricted and spend more time away from their home. And that meant that they had greater social experiences. And I actually really liked this quote because the service user said to the CQC inspector, "It's nice to know that someone cares enough to fight for you." So those are the examples that I had. And I've put what else are these providers doing, because I don't know whether anyone's been listening to me talk and having thoughts along the lines of, well, we do that, we could do that, that looks really easy. And I agree. I think these are just things that I picked out that are examples that I thought were cool. But in all of the reports, it wasn't just that one thing that got them the outstanding, or that one thing that got them the 4. Every single time CQC had mentioned multiple factors that demonstrated how the quality statement was met. And actually, I think under the single assessment framework, you're feeling less pressure to go and find something that's really cool and innovative. Actually, what you're looking for is building all of that evidence, making sure you're ticking absolutely every single tiny part of that quality statement once you've broken it down and thought about what it means and what they're asking for. And it's that will get you the maximum points, not always necessarily doing something special or amazing. But actually, if you are doing things that are special and amazing, make sure you've got some paperwork, make sure you've got some documentation to back that up. So I think that's probably everything that's on my slide. So yeah, the feedback spans across all of the evidence categories, so it's always consistent where someone's kind of ticked all those boxes, but actually also where, you know, the people's experience and the feedback from staff or service users has matched up with the systems and the processes and the documentation and the policies. It's important to know that nobody's getting 4 across the board in every single quality statement, and people are still getting outstanding. And all of these examples, I think, as I just said, are things that you can do or are doing. So thought just needs then to be given as to how you demonstrate that to CQC. So, you know, demonstrate across all your evidence categories, write case studies if you're trying to demonstrate a certain point about how you've achieved a particular outcome for a particular individual. Make sure you keep any positive feedback from professionals, even if it's just a one-liner. Make sure you're actively asking for that. Try and issue staff and service user or family surveys and file them. Make sure your documentation around audits. I mean, I'm copying what Philippa said, really. So make sure your documentation and your audits and your care plans are all consistent, and all of that put together showcases the good work you're doing, and that's available for the inspector, and it helps you get maximum points in each.
Fantastic, amazing, absolutely phenomenal as always. Thank you so much, Philippa and Jolena. And it really is about getting the basics right. I'm not going to repeat it because you both said it. Get the basics right. And I loved your phrase there around the feedback, Philippa. Get it, use it, and make changes. And I bolded action plans with tasks, clear plans, and evidence of completion and changes made. So there's some takeaways. Lots of applause coming in. So you've clearly really helped. And I think, Jolena, what you've said there is really helpful, because so much of what you said is what I guarantee I've been to see so many services care providers are doing all the time, every day. It's about making sure evidence is provided to the CQC. So absolutely fantastic. I think the other important one is workforce wellbeing. Not to underestimate that one. We've got an EAP solution. I did put a note in the chat around it, but there is a huge potential to support the workforce, but showcase to the CQC that that's what you're doing, what plans you've got in place, what counselling and support and services you're offering, helping with financial wellbeing. There's so much support out there which costs you little or absolutely nothing, which potentially could help. Now, we have had a few questions. Some of them I think are probably outside the scope of the webinar. I have been putting them in the chat. But there are, I think we'll try and get through a few of them if that's okay. If it's okay with you, I'm just going to go to a slightly different order. One of them here was, it just said, considering the CQC focus on well-led, safe and effective care, how do providers ensure safe financial wellbeing and health are supported? What practice or approaches does the CQC look for to demonstrate that staff welfare is effectively monitored and promoted? I think that really plays the point you were making, Jolena. Is there anything else you can say on that?
I'll jump in there, Richard, if that's all right. Jolena, do you want to stop sharing your screen now so that we've got a bigger space? What we're seeing from CQC is that those services who prepare for assessment are getting the better ratings. And those services where the staff teams talk very freely and talk very freely about the culture of the organisation are the ones that are getting the higher marks. So if the service genuinely feels like a family, even if it's one of the big, national organisations, if the staff are really comfortable around speaking to the inspector, they're really comfortable about saying, I've got this concern, I can talk to the manager about this, or I've got this, deputy manager that I can go to with these concerns. And where the service demonstrates that we've had staff meetings, we've listened to what staff want, we've put support in place as to how we can help them with financial issues, their own personal well-being, their own health and welfare, that it isn't just, oh, well, we've got an employee assistance program, or, here's a phone number for, a debt charity, where the actual culture of the organisation is a supportive one, really, really shines through. Because what lots of services forget is that even though they're concentrating on getting all their documentation and their policies and procedures right, and care plans and risk assessments and everything else, the staff are your biggest asset. And what staff say to CQC is invariably negative, because they'll whinge and moan about not being paid enough and it being a really hard job, and, well, I could go and work in Aldi or Amazon and get paid more. But if you give staff the tools, if you talk to them around, well, how have you made a difference today? If you say to them, before everybody goes home at the end of every shift, I want you to write something positive around what's happened today, you start to change the way people feel about their job and feel about their service, because they realise they're making a difference, they realise that they're valued. And if the organisation is then also valuing them because they're giving them support, they're helping them with car loans or any other financial support or information that they might need, it's the staff who then sell the service for you. So it's less around you saying, we've got this program and that program and we support in this way and we support in that way. It's about what the staff teams would say to the CQC inspector about how valued they feel within the organisation. So that's quite a long-winded roundabout way of answering the question, but I hope it's helpful.
That's very helpful. There's a few more questions popped in, so I'm gonna focus on those before, because I think they're more targeted to the webinar, but we'll try and follow up on some of the others that we might not address here. One question says, I suppose we still have variability for the inspectors, finding they're spending less time on site, so their invaluable time scoping with the team and others in the care home service is not always really pulled through, and the reliance on evidence documents really does mean the true cultural values are not observed. How do you think we can overcome that barrier?
It's a really difficult one, because you are beholden to the inspector that walks through the door, whether they got out the wrong side of bed that morning, whether they had a bad week last week, whether they're a really open personality who just wants to learn about a service. But ultimately, it's your inspection. You need to drive it. So it's really important that you're as prepared as you possibly can be, that you force feed CQC as much positive information as you possibly can, but also that you're prepared to use that factual accuracy challenge, and also prepared to make complaints about inspectors. I've unfortunately had experience where inspectors have been very negative, have gone in with a very negative attitude, have made inappropriate comments around artwork that service users have done that's on the wall, for example, and the only person that is ever going to be able to do anything about that inspector and that inspector's conduct is you, because you're the only one who can say, well, I witnessed this and they did this and they did that and they said this and they said that. It might not change your immediate rating, but it brings to CQC's attention that they've got people within their service who would benefit from retraining, or perhaps shouldn't be inspectors, and they need to be held to account. So whilst you can try and drive the inspection as much as you possibly can in terms of what you want them to look at, ultimately, if you're met with that kind of stone wall of somebody that won't engage with you, then raise it, because that's the only way CQC are ever going to find out.
Brilliant. And I'm conscious of time, so I'm going to skip on to a few more, if that's okay. Jean-Philippe has also said, in terms of PRN, sometimes it's difficult to get signed off from the GP. So we obviously accepting the fact that there are going to be things that are outside of your control that you would like to do, but in that situation, how do you then evidence to the CQC that actually you've got a GP that's not doing their bit, that's holding you back from showing how outstanding you can be as a service? What would you do in that situation, Paula? Philippa, sorry.
Make sure you've got the emails, and make sure you've got notes of the number of times that you've tried to ring the GP. You know, send those emails through to the GP or to the practice manager. You know, and a little bit like you know, where Jolena talked about struggling getting DOLS standard authorizations from local authorities sometimes. As long as you can demonstrate to CQC that you're doing as much as you possibly can at your end, that you've got those emails, you've got notes of the number of times you've tried to ring the practice or you've tried to engage with the GP, there isn't an awful lot more you can do to effectively cover yourself.
Brilliant. Thank you for that. There is another comment in there, which I'm not going to ask you to comment on, Philippa, but just as I'm sure I've read somewhere that the CQC are reducing the number of quality statements. That is an ongoing project. They have spoken about that at their roundtable events that they're touring the country with at the moment. That is in flight. It is happening, and we're engaged with that process. So there'll be something coming in the not too distant future on that. But there'll be a consultation that talks to it before it goes live anyway, and there'll be plenty of time for providers to get involved.
And certainly if CQC turn up tomorrow or in the next 6 months, they'll be assessing you against these quality statements. So, you know, don't take your foot off the pedal if you're partway through preparation at the moment.
Yeah, and I think what's really important, as you said beforehand, when we had the Chloes and we went to the 34, you're not doing anything different. It's just how you evidence stuff. So keep doing what you're doing and evidence all those things.
And one of the things we say about the quality statements now anyway is that part of the reason why they're looking at being reduced is because there's so much duplication. But there's lots of times where the same piece of evidence might go into, you know, 5 or 6 different buckets to evidence, you know, compliance in different quality statements.
Brilliant. Now, Paula, I'm going to put you on the spot here. Philippa, sorry. I've got a friend called Paula Doyle, and I always do this to you. I do apologise. A couple of questions that are probably slightly out of scope here of the call, but I'm going to ask them anyway if that's okay, because there's no more that have come through.
If I can't answer them, then I'll say.
Sure. How does the CQC ensure that safeguarding concerns raised by employees about their organisations are investigated impartially without prior notification to the service provider, especially in cases where early warning may allow concealment of the issue? It's an interesting question.
It's a very interesting question. It is outside the scope of my expertise because we're very much looking at straying into kind of whistleblowing areas. I would expect the CQC to be dealing with the individual in a very sensitive basis and speaking to the individual, also speaking with the local authority safeguarding team and handling it in a very sensitive basis, and them agreeing a way forward to be able to address the individual's concerns and do investigations before they then alert the provider as to the steps that they're going to take. But that's about as far as I can go with that one, because I'm not 100% on kind of individual kind of whistleblowing arrangements and how those are managed within CQC themselves.
Absolutely. And I think the other point to try and turn it into where you have talked about before is about creating that environment and that culture where people are able to come to you and talk about their issues and problems.
Absolutely.
And feel that they're listened to and they're changed. So if it gets to a whistleblowing, it's almost gone too far. The culture doesn't necessarily safely exist for people to be able to have those conversations and express those views openly and feel safe to do so. So that might be some good feedback, that if you are getting whistleblowings, I mean, there will always be some staff who you just unfortunately are going to raise go directly to the CQC, but you would hope that that culture, if it is the culture the CQC want to see, that people feel able and safe to open up and have a culture of sharing and learning from mistakes, and there's a no blame culture.
I think what we're seeing as well is that, particularly with the overseas workers, the thought of holding your hand up and going to speak to a register manager, effectively that your boss in the service, is something that fills people with absolute dread. And it doesn't matter how friendly and warm that person is, that worker will never ever go to them. So what we've done some work with some services where we've suggested that they nominate kind of an intermediary, that if there's somebody who the overseas workers are more comfortable talking to, who's maybe a senior carer somewhere, you know, within the service, that they kind of have that intermediary step down, so that rather than feeling that they need to go externally anonymously, they can come to that intermediary person who can address any concerns or gather those concerns together, and a little bit like a union rep, but not in a kind of formal confrontational type way. They can be that intermediary between the overseas workers and the register manager, to try and bridge that gap between, you know, any concerns or any misgivings anybody might have within the service.
Fabulous. And that kind of answers the next question I was going to kind of talk to, which was specifically about the international workforce that we've got. And there are definitely some cultures of people who have come to work in our sector whose culture is to not question and challenge authority. So yeah, creating those opportunities is really important. But also you did mention unions then, and unionisation is coming for our workforce. It's part of the Employee Rights Bill, part of the Fair Pay Agreement. So care providers, we're going to have to get our heads round the ability that staff will have the opportunity to talk to people. There's another question.
Sorry, I was just going to say I've seen a fantastic piece of work with one service that Jolena and I did some training with recently, and it's the service and the sector can be very white dominated in terms of leadership, but more culturally diverse in terms of the staff teams. And in this one particular service, they had someone who was more culturally diverse, who was part of the senior leadership team, and rather than kind of dancing around anything, they used her in inverted commas, and she was happy to be used to properly explain someone from a different minority group how they feel in any particular situation. Because much as white people can be, you know, very empathetic and try and understand what it's like to be in that situation, I'm not sure in lots of circumstances that we truly can. So again, that was really good evidence for CQC that they had somebody from an ethnic minority in a senior leadership position, who was that kind of real engagement in terms of, well, actually, this is the perception and this is how it feels and this is how we could and should do things differently, that would make our workforce feel more supported, rather than us trying to impose what we think would be more kind of ethically diverse and kind of equal opportunities.
Absolutely. Right, I'm conscious of time. I've got two more questions. That's okay. One of them is around meds errors, and we need to think about that one. But struggling to find published data around statistics around what acceptable meds errors are. We know there will always be meds errors if it's human nature. We know there are built-in EMAR meds errors. But you know, data. What are CQC looking for? Any thoughts on that, Philippa? Yeah, Philippa. Sorry.
No, you got it right that time. I think it very much depends on the service. If you see an isolated issue here and there, it's people caring for people. It's about how the service responds to that isolated error and being able to demonstrate that we recognise this was an error. We picked up the phone to 111. We did X, Y, and Z. You know, there was no harm that was suffered by the individual. But if you've got patterns of meds errors that keep occurring and they're not being properly audited, they're not being followed through, they're not being addressed, then that's going to be more of a concern, even if it is only a handful, if it's the same person or the same time or the same staff member. But equally, if there are a whole host of other bits and pieces that are not quite right within the service, then CQC will throw in, oh, and we found the odd meds error as well. And so it will creep in because it's part of an accumulation of issues, whereas on its own, it would just be an isolated incident that might get one line in a report, but of itself, they wouldn't make a big song and dance out of.
That does kind of feed onto the very last question, if that's okay. But one service has been inspected recently. They've taken some sort of slight issue with the way in which we've talked around reviewing an abbreviated number of quality statements when someone's come in and had all 34 reviewed. But there are the service is explaining that the CQC have analysed things like some daily notes and given feedback to the service to prove that something's wrong, but the process itself is slightly flawed, is their concern, but not completely inaccurate. And the comment that I think for you to comment on is that one mistake does not constitute a bad service, but then when it returns an RI or an inadequate rating, it seems very unfair. And of course, no one, as you said before, scores good or outstanding in everything. Even we've got some outstanding service and they've got some moderates, some lower scores, but it's the average score that gets you the overall rating, doesn't it? Is there anything you can kind of talk about there, Philippa, where 1 or 2 points are raised and the feedback, returns an RI or an adequate rating?
Yeah, I think it's very important to look at proportionality. We've had experience of services in the past where the inspector has got very focused on certain areas that have then just been repeated all the way through the report. And they've become almost quite blinkered because they've found this one area of concern that they've then done this real deep dive into, and they've tried to replicate it throughout the report. And they've lost sight of the bigger picture, and they're not engaging with and they're not looking at the good work that's going on within the service. And I think if you find yourself in that kind of situation and getting a draft report that feels disproportionate because they've relied on one issue or one or two issues, then that's where it's really important to use that factual accuracy challenge and use it as an opportunity to say, yes, okay, there was this one issue, that this is how we dealt with that one issue. And it is one issue out of 100 really good examples of things that we've done. And here's all of the evidence that demonstrates that we've got all that really good experience. What we find with factual accuracy challenges is that people are really reluctant to use that as an opportunity to throw the kitchen sink at things. But we very much take the approach that not less is more, but more is more. Use this because this is your report, this is your opportunity to shine. CQC don't know anything about your service. It's your responsibility to tell them about all the good work that you're doing so that they don't just pick on one single thing that the local authorities reported to them or that an ex-member of staff or disgruntled family member has raised.
Brilliant. Well, look, thank you so much, Philippa and Jolena. It's been absolutely amazing. There's lots of learning to take away from there. I asked people to pop some comments in the chat if they found it helpful. We've got lots of thumbs up, lots of people saying it's really useful. We will get a copy of the slides and a copy of the recording to you so you can look at that again at your leisure. And again, probably use it as evidence to show the CQC how you're actually learning and taking this advice and guidance forward, because again, that will serve as great evidence of how you and your services are learning and developing and making changes. Thank you. We will keep in contact with you and invite you to the next sessions as and when they happen. But a huge thank you again to Philippa and Jolena. If you would like to stay on, Philippa and Jolena, we can have a quick chat. Otherwise, thank you everyone for joining, and we look forward to seeing you all again very soon.
Thanks, everybody.
Thanks.
Thank you.
Thank you.
Thank you.